respected CMD, MD, CMS Kharagpur Dr. Mahanti, CMS CKP Dr. Pani, CMS Ranchi, would be CMS Tata Dr. Achyut, incoming new staff surgeon Dr. Bihura, my dear colleagues, and the august gathering and my dear staff of Southeastern Railway. Today is definitely one of the auspicious day for Southeastern Railway in continuation of this 58th Railway Week Award. Is a new thing our respected CMD has introduced to present a brief result-oriented activities of different divisions. At the outset, I convey my hearty thanks to CMD for this opportunity. Adra is one of the second largest division of Southeastern Railway. The activities, performance, I don't like to bore you much with this mathematical jargons of different figures. So I want to present the visual impacts of Adra division, our activities in the past and in future. This is the frontal aspects of our building, 3-storied building, with the beautiful gardens in front of it. In brief, the achievements in 2012-13, some of the works has been done is the renovated OT, few pictures enumerated below with OT in charge and the ANOs. They are preparing everything for incoming surgeons and anesthetists to make it fully operational. Second achievement in 2012-13 is this newly constructed OPD building. It's a beautiful building. It has come up with beautiful infrastructures. Some of the photographs of the frontage of that building. It's a huge complex with 10 rooms for all specialists. Number 3 is the installation of auto analyzer in pathology lab, which has given a tremendous help to clinicians for their diagnosis and minimizes the workload by this auto analyzer. This is the auto analyzer. Next was the procurement and installation of 2 numbers of refrigerator, which is used for storing of reagents and serum specimens at -20 degrees centigrade. This is the refrigerator, the outside and the inside view. Now the achievements proposed, planned for 2013 and 14. The medical examination, it was a huge task for Southeastern Railway, especially for Garden Ridge, Kharagpur and Adra to complete the massive Group D candidates to be examined within 7 to 10 days span. It was a huge task which we could achieve within a short span, which has been highly appreciated by our respected CMD and CPO. Handicap cases, so around 750 candidates were examined in 10 days at Adra. And handicap cases were examined 25 and medical board done with invalidation, AMG and commutation certain cases. MPSD camps were held at different places of the division. We did it at Bokaro, Wagon Repair Shop and Sick Line. Camp held at Wagon Repair Shop, Adra. Again, multi-purpose health rate camp was held at Diesel Shed, Bokaro. Another at Wayside Station, Mahuda, Chandil, like this. Some of the photographs I would like to show. This is the Wagon Repair Shop, Bokaro, showing the wheels and the seat coaches inside. And this picture depicts the diesel shed at Bokaro where MPSD camp was held and 150 cases were examined and treated. This is one case during the camp, the interesting case of ranula. Our young dynamic doctors heading towards examination of patients during MPSD camps. This is one of the AIDS awareness campaigning during MPSD camp at Bokaro. In continuation of that camps, those are the photographs. MPSD camp was held at Wagon Repair Shop, Adra. Now the camp was again, we did it last week on 22nd at Health Center, Mohdar. This is the frontage of that camp. That the decoration shows the involvement and dedication of the doctors and staff of Mohdar. It gives a feeling of some celebration like environment. There I was asked to speak on this AIDS awareness campaign to the mass. Our doctors busy with that camp. Patients were being examined by Dr. Mrs. Nanda, Dr. Das, Dr. Murmu. And it came out in Dainik Bhaskar on 27th May, Dainik Bhaskar newspaper, the activities of our camp. Coming to World Health Day celebration, it was advised by our respected CMD to conduct this WHO Day celebration in a big way so that people will be aware of this year's theme, which was for hypertension and lifestyle modification. So we conducted one walk for healthy heart involving DRM, all officers, medical staff, with a distance of 2 kilometers being covered in the colony, followed by a gathering in the hospital auditorium with some deliberations on hypertension and lifestyle modification. This is the program which starts from the club with our scouts and guides, boys, with our medical staff holding placards showing different slogans of theme of the day. This was the video clippings of the walk showing involvement of our ladies were all our nursing staff and the paramedics, followed by officers including DRM, who actively participated in this WHO Day celebrations. And listen to the early morning birds.
evening birds का सुनना पड़ेगा.
Dr. Murmu giving his deliberations. Those are some of the photographs of those WHO Day celebrations. In special activities, the sentinel surveillance were done for HIV 2,000 cases in last 2 months. Simultaneously, HBSH and SCB surveillance are also doing regularly. And most important thing is that we have done for the first time outsourcing of sanitation of Bokaro railway colony with surrender of 23 posts, which tender has been opened and work is going to start soon. At the same time, we have planned for so many places, MPSD camps at different wayside stations as well as at workplaces like control room, RPF barracks, workshops, DRM office, etc. And officers' health camp is due next week. And special health drive for ladies also has been planned in difficult places like Bhujudi, where cervical and breast cancer detection camp is going to be planned. Our academic activities are going on, like in-house training of nursing staff and dressers and other paramedics too. At the same time, first aid training for Group C and Group staff of all departments is actively going on as per the advice of DRM. At the same time, regular clinical meetings for doctors are held for updating clinical knowledge in all fields. At the same, we are also conducting medical audits like death audit, indoor audit and OPD audit very regularly, whereas we can find out any improvement with our working and treatment of the patients. At the same time, since Agra is now, we are facing a lot of difficulties for managing cases because of lack of certain specialties. So we are bound to have tie-up with different non-rural hospitals in the surroundings. Number one is Bokaro General Hospitals. All the important cases in emergency we used to refer to Bokaro, and other hospitals in the tie-up we are trying is Brahmanand Narayan Hrudayalaya at Chandil, Tata. Second is the Mission Hospital at Durgapur, and third is the Bharat Cooking Coal Limited, which is a Coal India hospital, which is located at Dhanbad. So patients of nearby areas, I hope will be benefited in during emergencies where they can be referred to and treated properly. Equipment and tools planned and proposed for the next year is the new 300 MA X-ray machines, which is going to be installed very soon. At the same time, installation of color Doppler and upgradation of pathology lab is also on the pipeline, like glycosylated hemoglobinometers, automated hematology cell counter and relocated tunnel lasers. Infrastructure developments, there is a 20-bedded double-storied patient-related rest house which is nearing completion as per the advice of last MR. And second is air conditioning of hospital auditorium is on the pipeline, where we can benefit it for all the academic activities and the training programs. And there is a proposal of covered passage, because now the new OPD complex is quite far off from the main building. So during summer and rainy season, to protect the interest of patients, a covered passage is being planned. At the same time, the physiotherapy unit is very old. It has been also accepted in the minor works program for its infrastructure development as well as upgradation of machineries. This is the 20-bedded protective rest house, which is going nearly completion. Now the specialist requirement, already I have highlighted to my beloved CMD that the lack of surgeons, physicians, anesthetists and orthopedic surgeons, it will be provided for a smooth and effective functioning of our 2-bedded hospital. And thank you for your kind attention.
Thank you, sir. Now I request Dr. Pani